My background basically, just to sort of introduce you how I got into this, and I'm not going to spend a lot of time with that, but is I started with acupuncture. I'm a board-certified family physician, as Dr. Gordon said, and I got tired of the usual poisoning of people with things like non-steroidals. And you know, after how many patients you admitted and took care of because they were dying from my pain management, I said, well, I've got to do something else about it. And that was in 1987, where I had this enlightenment. So I did the acupuncture training program at UCLA, but because it was 89, acupuncture at that point was still, stay away from me with those needles. So I started looking at other options, and I started looking at magnetic therapies, using magnets over acupuncture points to do the same kinds of things, because they were using those as alternatives in China as well. There wasn't much information about it, but they were effective. So I started working with that and started reading, tried to get my hands on as much literature as possible. There was very little human literature. Most of it was in Russian or German or Chinese or Japanese, so it was just not that available to us. But I persisted, and I began to eventually work with an MD PhD from the Czech Republic who was responsible for authorization of magnetic devices in the Czech Republic, and was also a researcher and did a lot of research himself on magnetics. And that kind of really blew it open for me. So I originally started with static magnetic fields and then began to use, and more devices started becoming available. Because one of the problems at that time was the availability of devices. You either developed your own, or you tried to get something from China or Russia or Germany, which was not always that easy. But finally they started coming our way. And so that really sort of blew open the options for us in terms of what we could do. What I found the difference is between static magnetic fields is very often they don't work very deep in the body unless you have huge magnetic fields like the MME, or even the bed, Dr. Bonnelly's bed, which does envelop the entire body. But often it takes a long time for statics to do the job in the body. Pulse magnetic fields can do it much faster. So I began to use pulse fields a lot. And obviously now we are becoming more used to in our culture the concept of magnetics in some degree, in some fashion. Who in medicine, biophysics is not taught in medicine. There's no training in biophysics in medicine until you get into the specialties. When you start getting into radiology and nuclear medicine, you basically learn no biophysics. Maybe in physical medicine they do some of that as well, but most doctors are absolutely totally blind to it. They have absolutely no awareness of the body as an electric apparatus. And I don't know if any of you have read Bioelectric, but that was really sort of like an eye-opener as well. That the body is fundamentally a bioelectric apparatus. And as such, it can be accessed and stimulated to achieve some of the same things that you do with medicine. And if you use the combinations of things, you're going to get much better results than doing any system all by itself. I never treat a patient who I treat with magnetics alone with magnetics. You also have to have the nutrition, you have to have the sleep, you have to have the rest, you have to have the detoxification, you have to have the psychology. All of that still has to be in place. And you can't build a house without bricks and mortar. You can't repair the body with magnetics without having the nutrients in place to be able to do the job to do repair. So you got to remove the toxicity. So this is an MRI scanner. Now, so what kinds of magnetic devices are there? There are a lot of FDA-approved devices already. We're not aware. They're sort of sub rosa. They're under the radar in terms of people using them. The only one that we do know of consistently is the MRI. But there is a device that stimulates muscle contractions called the Control. It's still out there. It's FDA approved. It was originally approved for treating incontinence in women. But there's other uses for it since. There's a device called the IVV, which is FDA approved, Medicare approved, but not funded. So you don't see a whole lot of IVV products out there, but they're used by the plastic surgeons primarily for wound healing. It's a higher frequency system, very low intensity but high frequency. I had a patient and a nurse actually I treated with RSD with one of their devices, and after about 3 months, gone. She was working in her office with her arm propped up on a pillow. No help. From anything medicine was doing, we treated her with an IVV machine, high frequency machine, gone. Totally gone. Regenerix, I don't know if that's the name, Regenesis, is a new device for wound healing purposes. Again, it's got FDA approvals, but nobody's paying for it. EBI, Osteologic, all these others are basically bone stimulation devices, and they have been FDA approved for 20 plus years. They're in use in orthopedics for non-unions and fusions. Right? They have other purposes. And in fact, the company, I talked to the medical representatives of the company, and they wanted to get a new indication for osteoporosis. Because if it stimulates osteogenesis in fractures, wound fractures that have been sort of ununited for years, even 5 to 10 years, all of a sudden you start the magnetic therapy and the wound fracture starts healing. In 6 to 8 months, a year in some cases, fractures heal. Just with magnetic therapy. And in that circumstance, the electrical therapy did not work, but the magnetics did. And there's some technical reasons for that. Now there's a magnetherm and diapulse. They've largely been eclipsed, but diapulse was FDA approved, still FDA approved. Medicare still pays for it for certain applications. Transcranial stimulation, the Neurostar, is now taking the world by storm. Now this is where we're really going to start capturing the attention of the clinicians. MRIs for diagnostics is not thought of obviously as a therapeutic system, but some people actually get therapeutic benefits while they're getting their MRIs. In fact, actually, at one of the hospitals in Boston, they're actually doing, like the Neurostar, they're doing research because they discovered a number of their patients with treatment-resistant depressions, when they had their MRIs, the depression went away. So they started developing their own magnetic device, which is basically still transcranial magnetic stimulation. All right, so this has utility that like everything else we do in medicine, we tend to get tunnel vision because the FDA says this is what you can use it for. The EBI device, I tried to buy some on eBay. They're time-locked. The FDA has put handcuffs on them. You can only use them for X amount of hours or X amount of time. And that's it, they shut off. And then you have to go back to the company to recharge it, but you have to have the proper indication, because if you don't have the proper indication, when they come in and review the company, they can shut it down. So they're kind of locked. You've got a golden handcuff, but you also got a golden parachute. The approval is the parachute, but then you got handcuffs. So anyway, transcranial is going to eventually expand beyond the boundaries of just depression, anything neurological. But it's not just depression. When you understand magnetics, you'll understand the utility of magnetics is just wide-reaching. It's just phenomenal. And then there's others. OTC, you have all sorts of things. So we're talking about the PEMF 100 as being the device out there as OTC. That's a high-intensity system. And you have lots and lots and lots of low-intensity systems that are coming to the market. And there are lots of claims about them. All of them have benefits, advantages, and disadvantages. And I review a number of them on my website. This is the Neo control system. You sit on that device. It's hilarious. I have never heard women giggle. You treat incontinence with this, and women start giggling. Now, they also create an endorphin rush and do a bunch of other things, but you're strengthening the muscles, pelvic muscles, passively. It's better than Kegels. Kegels doesn't work. We know it doesn't work. And then the other stimulation systems are horrific. Putting electric probes into the vagina and trying to stimulate the pelvic muscles. I mean, that's ridiculous. This does work, and there's lots of research to support that. It's not a cheap device either. It's about $30,000, $40,000. And that's called the Neo Control. Lots of trials have confirmed efficacy. FDA approved in '98, actually. And they developed an indication beyond the pelvis with something called the myotone or the neotone, which actually is used over fractures or can be used over... But it's a small device. It's a small little area where you stimulate muscle through casts and so on. You've got exactly the same thing you can accomplish with the PEMF 100. And it's been used in a lot of clinical practices. There's tons of studies and so on. So now they've also found that it could be useful in treating fecal incontinence, pelvic pain syndromes in males after following prostatectomy, fecal incontinence in males and women, pelvic pain syndromes like prostatectomy, chronic prostatitis. Often we'll get better with this. Same thing, you can do the same thing with the PEMF 100. Neotonus is the muscle stem system, neuromuscular tissues for bulk muscle excitation for rehabilitation purposes. In other words, you're getting bulk muscle stimulation, because you're stimulating the nerve that controls the muscle. Right? So you can get a whole muscle from the nerve on down the extremity to be stimulated. Deep, deep, deep. You go way down deep into the pelvis. I have a piriformis problem. I was using the PEMF 100. After about 5 treatments, gone. And you know how difficult it is to treat piriformis. All right, and so you can do relaxation of muscle spasm, prevention of disuse atrophy, increasing local blood circulation. Anybody in a cast for any length of time, losing muscle mass. So if you've got a fracture that's stable enough to be able to treat, to create muscle contractions, you have to be careful about stimulating a fresh fracture and creating muscle contraction. But at some point you want to begin to rehab that muscle inside the cast. It will also actually accelerate the healing of the fracture by getting the muscle contracting, because you're creating piezoelectric fields in the muscles. When you do that with a muscle, you're creating a charge moving down the fascial planes, the interstitial fluid, at the rate of 30 meters a second, much faster than any nerve can conduct. When you introduce a charge into the tissues, you're stimulating all these ions. The same thing. You're creating these charge flows that are just phenomenally rapid in the tissues. You increase local circulation, muscle re-education, okay, increased range of motion, prevention of DVT. That's the NeuroStar. We already saw that. So it focally stimulates the brain and other local tissues. So wherever you apply it, you focally stimulate. Periodic repeating patterns. That's why they call repetitive TMS, and you'll see the term frequently RTMS. And often they won't say transcranial magnetic stimulation, they'll say RTMS. So that if you do a search on it, you'll do a search on RTMS. And it's repetitive rather than one pulse. It's a series of trains of pulses. There are different designs for these systems. And we'll see more of these machines being improved down the road. So this fast RTMS, which is greater than 1 hertz, 1 cycle per second. Fast RTMS, a very brief run. So you can do brief runs of 20 to 30 cycles per second. So like trains, and it's a pause and a pause. And you have to be very careful though, because fast RTMS can actually potentially increase seizure risk. This is the PEMF 100, which you see out there. So it has a variable intensity between 100 to 200 microtesla or millitesla. So a millitesla is basically 1 Gauss. 10 millitesla is 100 Gauss. So 1 millitesla actually is 10 Gauss. 10 millitesla, I don't have a table for that. 10 millitesla is 100 Gauss. 100 millitesla is 1,000 Gauss. A Tesla is 10,000 Gauss. Most MRI scanners are somewhere between 2 and 12 Tesla. Okay, so you're talking about tens of thousands of Gauss, between 20,000 to 100,000 Gauss. All right, so what we have then is a fairly low-level system. It's about 0.1 to 0.2 Tesla. Okay, it's a tenth to a 20th of a Tesla. So that's a very powerful field, relatively speaking, without costing $1 million. And so you don't always have to get to the size of an MRI machine to have that kind of thing accomplished. So variable frequency between about 1 to 35, hertz. It should be hertz. So when you put it down at the highest intensity, it has the lowest frequency, and that's about 1 cycle per second. When you turn it all the way down in terms of intensity, almost to where you're not going to feel anything at that point. You're really actually still getting about 100 millitesla, 1,000 Gauss. Okay, that's a lot of power still, without causing muscle contraction. And you've got multiple coils. You have different types of configurations of coils. It's a capacitance discharge system, just like a light, just like a flash in a camera. A battery builds up a charge, or in fact, in this case, a capacitor builds up a charge and discharges. You have to build very fancy capacitors to be able to get frequency rates of 35 millitesla. The same thing happens with MRIs. There's a physical limit to how fast the MRI can actually produce a pulsing field. And then you get these huge machines that are, and the engineering in them is very sophisticated, of course. That's why they cost so much. But at the top of the pulse, there's almost like a shower, like you would with a display, on Halloween, New Year's Eve, etc. You get this scatter of frequencies that's just thrown off at the top of the pulse. So you get all these harmonics. You get the basic subtle frequency of the basic pulsating system, but every time it flashes, at the top of the flash, you get a discharge, a coronal discharge, if you will, of a whole range of frequencies, low to very high. But it doesn't last very long. It's not that powerful. At the top, it's not that powerful. Okay, and what causes the muscle contraction? This is an important thing for us to understand. This is the PEMF coils. So there's 4 different coil patterns, and there'll be more in the future. This is the EBI machine with a control unit and a very small area applicators, because again, you're treating generally a single individual spot where you have a fracture. Now, we alluded to the concept that we're losing field on the Earth. This is where truly you have to understand, if you don't use it, you lose it. Since the body's bioelectric, if you're not creating charge, you're not moving muscles, if you're not pounding bone, you're not creating charge in the body. You don't create charge, tissues atrophy. So we are totally dependent on a whole host of fields that permeate our lives. A huge part of the effects that happen to athletes or to the astronauts and the people up in the space station is not because of the loss of gravity. It's the loss of the magnetic field. The Russians have been studying these models because they've been working towards a Mars mission. I actually met with the medical director of the Russian space program. We had a long discussion about this. They're very concerned about the lack of the magnetic fields that the humans in long space missions are going to experience. And they're very, very serious about engaging in and developing the technology to be able to have a long-term mission. Right? You can measure the fields around the body. That's called bioelectromagnetics. And the body's own magnetic fields are on the magnitude of, say, 100,000th to 1/1,000,000th of a Gauss. Okay? Every atom produces a magnetic field. It's a magneto. Every atom. And you have a group of atoms working together, and you're going to have a bigger magnetic field. The body itself produces a magnetic field. So when you talk about auras and body fields and healers and things like that, we're actually projecting a pretty substantial field. Animals know it. Trees know it. Right? We can't perceive it. Our senses can't perceive that. But there are systems that can perceive those magnetic fields. You have to blank out the Earth's magnetic field in order to measure the body's own fields. Because we're totally permeated in a constant magnetic field around us, a DC field. And that's one of the limitations of static magnets. Magnetic systems act through the body because the body is largely a lithocrystal matrix. It's got a lot going on. It's got a huge amount going on. And the thing is that it's going on. You can move a body in motion, you can change its direction a lot faster when it's in motion than if you have to move it from static position. Anytime you push the body, put a charge in the body, you push it. It's easy to push a whole lot of stuff. And you can't always know what you're pushing. You can't be surgically precise in what you're pushing. Everything has a consequence in the body. I tell my patients, when I do that, where's the pain? Not in my knuckle. Okay, sure, I feel it in my knuckle. It's in my body. My body's flooded with neurotransmitters and other neurochemicals that say, ouch. Right? So you can't be surgically precise. It just doesn't work that way. The body has all sorts of its own frequencies that are at a gross level. Things like the cardiogram, the magnetocardiogram, so we can actually measure. There are devices that measure the magnetic field of the heart. There are devices that are now used to measure the magnetic fields of the brain. You can map the brain for seizure thresholds to be able to do implants or specific surgeries. That's magnetoencephalography. That already exists. Audiograms, kymograms, the pressure pulse of the heartbeat, thermograms, the heat pulses of the body itself. So a pulse, every time the heart beats, it produces a pulse. That pulse is creating ions downstream. You've got static molecules sitting in the blood vessel wall. What are they doing? They're being stimulated by the pulsing of the blood itself at a piezo level, at a micro level. But again, in the body, micro is huge. So when we're using a 1 Gauss magnet on the body, that's 100,000 times more powerful than what the body produces. So when we're using a 1 Tesla field, what is that doing in terms of magnitude? And processes get stuck. Why do they use the EBI machine? Because the body's healing processes are inefficient. And largely because we're in a magnetically depleted environment, we're even more deficient. And so things get stuck, the healing processes get stuck. And when you introduce charge or energy into the body, increasing the ATP in a cell by 500-fold, or 5-fold rather, 500%, what will the squirrel do in the cage then? It'll break the cage. Alright, so that's the body's own sort of natural field. These are configurations just to give you some sense. Every time you have a current flowing through a coil, you're going to produce a magnetic field, and you can design systems with a very complex magnetic field configuration. This is the chart on Tesla, milli Tesla, pico Tesla, nano Tesla. There are magnetic therapy devices that have been designed at the pico and nano level. I really don't know what they're doing because my talking could disturb a picotesla field. Okay, my putting a hand on somebody's shoulder while they're getting treatment on a picotesla field may be enough to disrupt the benefit of that pico field. And you have a computer sitting in your room, or a computer sitting on the wall on the other side of the room where you're sitting, gives your pico treatment, it gets bumped. Okay, so pico is just too small. There's so many environmental influences that are at that level. All right? So the advantage of the magnetic field is non-toxic, non-invasive, stimulates the body's own natural capacity for healing. It only influences. It doesn't give you a molecule that has to be processed by the body. It influences. It's like the wind blowing through the leaves. It moves the leaves. Okay, and the body will react, and it does what it does by moving the leaves. It's reusable. It's natural. It affects electromotive actions in the body. So the magnetic field pulsing through the body is actually, remember the liquid crystal matrix, it's actually pushing things. The stronger that push, the more charge is produced. When I go like that, what am I doing? I'm creating charge in my bones. I'm actually creating fractures that cause microfractures that recharge the bone and rebuild the bone. When you do muscle, when you do weightlifting, you're tearing muscle, you're generating the body's natural capacity to heal, which builds new muscle. Right? You can't do that without breaking something to rebuild it. You can't repair an old house without taking away the other, the old crap and putting in before you put in the new crap. Actually, the new crap becomes old crap eventually. Home or professional use. That's the nice thing I like about magnetics as well, is you can often provide people with systems that they can go home and treat themselves, particularly for chronic problems. It's complementary to other therapies. If you use electrical stimulation, if you use acupuncture stimulation, if you use ultrasound or laser, use these together, 1 + 1 doesn't equal 2. You actually get amplification of benefits, because each set of frequencies that you get with these different systems are going to be additive to what you're doing in the tissue, depending on what the tissues need. And we can't figure that out. That's very hard to figure out. So we try the best we can. And of course, there's lots of biologic evidence. So the body is very susceptible to magnetic fields. Tissues or molecules in the body are diamagnetic, which means they react, and they're paramagnetic, which means they accept. They can either repel, so like magnets. You put two magnets together, they either accept or repel. So molecules in the body are basically the same way. They accept or reject the magnetic fields, and the different molecules will react differently depending on which effects they have. But in aggregate, the body's cells and molecules are diamagnetic. That's why magnetic therapy works. So most of the time, the body's magnetic cells are actually rejecting the magnetic field. And the rejection process is what creates the charge and the dynamic action, for the most part. And so there's a set of magnetic susceptibilities in the body. This is a very complex chart, but it shows you all kinds of molecules and so on in the tissues: aluminum hydroxide, copper, zinc, etc. All of these have different magnetic susceptibilities, and lots of that has been mapped out. One of the key concepts is the body is absolutely transparent to a magnetic field. The body does not absorb them, for the most part, unless you get into electrical fields where you start to create charge. The body essentially will allow the field to pass all the way through it without reduction of the field. This is not the same for electric charge. Electric charge is absorbed by the body, but magnetic is not. Now, when you apply an electrical field to the body, when I take an electrical stim and put it on my skin, I get the electric field, right, which is going to be absorbed into the capacitance of the body, the resistance of the tissues, but the magnetic field will go right on through. And every time you have a wire that's producing electric, you have the same wires producing magnetic. I routinely advise my patients to use electric heating pads. I say, get a big thick towel. I don't care how thick the towel is. Get a big thick towel. Crank the heating pad up and use the heating pad, because the magnetic field is going to go right on through. I read a study in American Family Physician once, and the author said it's the heat that cured this patient's back pain. I should have written a letter, because that was going to be too educational. That it's really the magnetic field that's doing the job, not the heat.
I can't help but ask you a question about that, because I've heard for years that you shouldn't sleep on a waterbed or use an electric blanket, because now you're
that's a whole different ballgame.
To 60 cycles.
That's a whole different ballgame. Now you're talking about exposure to the same frequency for extended periods of time. You get coupling, you get reactivities in the body that may push certain processes in the wrong direction because it's a chronic, constant stimulus.
So you're saying once in a while an electric blanket is okay?
I think so, absolutely. If you're going to do it for 10 minutes, 30 minutes, Because it is 60 cycles. 60 cycles by itself is not in itself bad. It's the total amount of exposure that we have. I think that's the problem. Right? We can argue about that, but we don't want to spend the time doing that because I have an hour. Right? So we got to move on. Memorize this. Okay? This is the inverse square rule, basically. Magnetic fields drop off in intensity as you move away from the surface of the applicator. So you lose a huge amount of intensity from one side of the body to the other, from left to right. Right? So on the back, when I'm laying on the magnetic pad, I'm getting maximum intensity. On the other side of my body, I've lost a huge amount, maybe 70 to 80% of the field. So you may need to turn around. Right? You may need to move the applicators around. This is true for all magnets, but you can design systems, even D-Bombing's mattress pad, there's a limit. Out here, the field drops off dramatically. So, when you're in the space, the human's in the space, you're getting a fairly uniform field. But the bigger the person, the less uniformity there is. So eventually it loses itself into space.
It goes 2 stories high.
Okay, at some point. Here's a gradient of a single pole magnet and an alternating poles to the target. This is a 250 Gauss magnet. Whoops. This is a 300 Gauss scale. Let's say 300 Gauss magnet. So here the magnetic field is basically 100% at 0, right? And then you plot the intensity over distance, and you can see that by the time you reach about, let's say even in here, at about 2.5 centimeters, 1 inch, right? How much field do you have left? About a 90% drop off in field. And with bipolar magnets, that drop is almost instantaneous because of the gradients in the bipolar magnet. But a single pole magnet, you get a much more uniform gradient loss. But there's a loss of the field. It's important to understand. So if you treat two different people, the same lesion in the same place, but one's big and one's small, you might get a different effect. It may take more treatments to treat to treat the bigger person than it does to treat the smaller person. If you need a certain amount of energy at the spot at the point of treatment. Key. Now this is a rapid B field decay away from the core for I think this is, I don't know if this is MRI, but it's in Tesla. So you're talking about 5,000 Gauss, 0.5 Tesla, right? So that's 5,000 Gauss. So you have this huge drop in the field. So at 6 centimeters, again, what percentage of your field, your initial field, have you lost? MRI doesn't go that deep. It works about 5 or 6 centimeters. If you want to do stimulation, actually, I think this is from the neotonus machine. This is the measured field from the neotonus. So that operates, in order to create muscle contraction, it's going to operate maybe up to about 5 to 6 centimeters. And after that, you can't stimulate muscle. You're getting other magnetic field effects because it does a tail off close to 0. But it's frequency, which is again a whole different ballgame. You can stimulate the body at extremely low frequencies, way below the level of a static magnetic field, and create actions. Remember why? Because I said the body's own natural fields are about 100,000th to 1 millionth of a Gauss. So if you have frequencies happening in the body, particularly low frequencies, which have very long wavelengths, they're going right on through. High frequencies get absorbed by the body, so laser does not go very deep. Its primary actions are fairly shallow in the body. That's why you combine laser and you combine the extremely low frequency magnetic fields to treat the entire volume of the body. Right? Very different concepts in terms of the technologies. This is a TMS device, so this is transcranial magnetic stimulation on the certain neurostar. And actually they've done nuclear magnetic resonance testing, and they've measured the field effects inside the brain, the electrical charges that are produced inside the brain from that. And again, what you have is this same drop-off in field intensity. The inverse square root. Okay, that's why I wanted you to memorize that, the inverse square root. All right, size does matter. All right, to have a magnetic field act on an object to create a charge, the field must move past the object and the object must move past the field. There have to be a dynamic motion of charges moving back and forth to create induced charge. induce magnetic sort of electrical charges in the body. Time-varying magnetic fields induce an electric field whose magnitude is proportional to the rate of change. So you can have a very strong magnetic field. They go up like this and then basically be steady. Not much is going on. It's when it's changing that everything is happening. Okay? Once you're in the grip of it, there's not that much going on. It's really the change. And they've even discovered this with people who do dowsing work. It's the motion, the dowsing motion, and the way the water's flowing that makes the difference. And a dowser who got a magnetic field going from 0 to here to the ceiling there. When I walk into the field, as the field is increasing, I can sense the difference. Once I'm in the field and I continue to walk in the field, I feel nothing. That's how they perceive that. They're very sensitive to detecting very tiny changes in the field. But once you're in the field, you don't feel anything. Dean Bonley's bed, once you're in the bed, once you get onto the bed, you can feel something. When you're in the bed, you may feel nothing. That doesn't mean it's not working, but you don't feel anything. Not much else is happening except you're in a cocoon, in a sort of a stable, protective cocoon, but not much is happening. I didn't say nothing. I said nothing. Right, now this is a chart of magnetic field density from a static magnet, but the same principle applies. So you have these huge gradients, what we call gradients. The magnetic field goes from this point way down to this point. So these are magnitudes of change. 5, 10, 20 magnitudes of change in the magnetic field. And that's the key principle with pulse magnetic field. There are many magnetic phenomena that are subject to, they're more influenced by intensity. Some magnetic phenomena, some phenomena in the body, some tissues and some organisms are more sensitive to the field intensities, and some are more sensitive to the gradients. So it really depends on what you're trying to accomplish. And all that has not been mapped. These are simple charts of some of the changes they find for field-sensitive phenomena. Ersted's is another measure of magnetic density. And then this is a gradient-sensitive effect. Dowsing reflexes, I just mentioned, people walking through a gradient, changing field, tumor transplants, etc. We're going to go through all these. And this is actually quite old information. But there wasn't much else that I found that showed differences, charting differences between them. So there's no physiologic difference between the action potential initiated by an electric field delivered by surface electrodes and the action potentials that can be induced by specific EMFs. So when you stimulate a muscle with an electric charge, there's not much difference. You're creating action potentials in the muscle to create a contraction. There's no difference between magnetic fields doing that and electric fields doing that. So what's the advantage? The advantage is magnetic fields are non-invasive. And you have to be careful in designing electric fields that you don't burn the tissues in order to create a charge deep into the body. Right? And then, of course, they can be painful. You can change amplitudes, you can change frequencies, and so on to adjust some of those parameters. But essentially, these are the same thing. We'll be that. All right. So stimulating coil creates an electric charge. Electric charge creates a magnetic field pulse. Okay, Tesla, so it goes up rapidly and then it drops off rapidly, as we showed. The rate of change of the magnetic field, which is kilotesla per second, goes up like that very rapidly, goes down. This is happening sort of, in a sense, simultaneously. All of these curves are overlaid, but all of it's happening simultaneously. So you're changing the magnetic field, then you're inducing electric fields in the body in volts per meter, which can be measured. Induced tissue currents, amps per square centimeter. Induced charge density in the body, etc., and then you have a behavioral effect. So you can see these are very comparable looking shaped curves, but they cascade through a whole series of events in the tissues. You can change the parameters of any one of these and change the characteristics of the field. So now this is becoming very complicated. I'm not an engineer, I'm not a physicist. You need a team to understand magnetics. You need biologists, you need physicists, you need engineers, you need medical practitioners or doctors or clinicians to apply all of this. The engineers don't know anything about the practice of medicine or chiropractic or physical therapy for that matter, but you need the team to be able to properly design systems. This is one of the reasons it boggles the minds of doctors. They like to keep things very simple. Okay, this is the mean peripheral nerve stimulation thresholds and cardiac stimulation thresholds for the most sensitive population of tissues, basically. Again, you're talking in terms of Tesla per second. So you can see there are differences in terms of the density of the field and the ramp time of the pulse. So again, designing systems, depending on how long you apply the signal for, if it's short, they need to be much stronger. If it's longer, it could be a smaller signal, etc. But every tissue will have different current densities, or different densities in terms of how it accepts the signal. Again, this is just another mapping of the current and B fields for the accompanying stimulator. And they've mapped all these, put them simultaneously into one curve. Too complicated, I won't spend time with it. This is the PEMF 100. Jim, this is new. This is in time in microseconds, not milliseconds. Microseconds. You've got 6 Tesla, 5.5 to 6 Tesla, 5.75 Tesla max, 5.3 Tesla per microsecond. Right? Well, it's also microsecond there, but one of these other slides, I believe, was in millisecond. This is actually kilotesla per second. So you're taking 5 Tesla per microsecond. How many Tesla is that? 100,000, something like that? Multiply it out for the scientists in the room. So the PEMF 100 has a huge signal in terms of that rate of change and the induction of charge. Huge. Relevant. Okay, so it produces better effects faster. That's why we like the PEMF 100. It does it better, faster. So you can have picotesla fields, you can have millitesla fields, like 1 or 2 millitesla fields. They work very, very well. And some processes of the body respond like that. Some processes just take a lot longer. So if you have something that you're trying to move faster, you've got professional athletes, you want to move things much faster, you're going to have to use a higher intensity field. This is the rate at which, with MRI, different frequencies absorb in the tissues of the body. And I won't go through this, but most MRI is up in this area, 20 megahertz up to 300 megahertz, which has a very high absorption rate, which is why you can burn tissue with MRI. If you have somebody with a tattoo, you'll burn their tissue because it creates so much charge around the metallics in the tattoo. Why you have to be very careful with any implanted metallic objects, because you'll create currents around those objects. Even with the PEMF 100, fillings. If you have fillings, you'll have pain. Not everybody does, but it depends on the positioning. I've got some implants as well. So between the implants and whatever other material I've got in my teeth, I will get some pain in my jaw. So we have to be careful. Especially treating tinnitus, or you're treating around the head, whether people have these things. And so what you want to do is keep that current density down. You're not going to go up to the highest intensities with that system with somebody who's got that kind of equipment in their body. So healing energy is produced, whether it's by a medical device projected from the human body. So medical device or projected from the human body in the case of a healer, or the natural, just approaching somebody to try to heal somebody, you're going to get magnetic fields from that body. There's going to be an exchange between those bodies of energy. And energy basically is a particular frequency or set of frequencies. So some of these things have been mapped in terms of the frequencies that healers will produce. There's a voltage wall at the Elmer Green's clinic where they took healers, and the healers will produce upwards of 1 million volts. You get a sudden discharge. They can measure their EEGs. Their EEGs build up this massive charge, and they just release it into the wall. And they measure that charge as 1 million volts. The human body is capable of producing significant amounts of energy and transferring. So most of the effects of PEMFs on various disease conditions are mediated through basic actions of PEMFs in biology. Critical to understand. All right, and you have all these different forces, types of physics forces, magnetic forces, magnetic torques, restrictions, constrictions, chemical reactions, etc. I'm not going to go into this. These are things that have been described for static magnetic fields. They apply to pulse magnetic fields as well. But they've been more elaborated with statics because you have all these other, you have to isolate the magnetic field from the frequencies and so on to be able to study some of these effects. So applying a magnetic field to the body is like throwing a pebble in the pond. That's where the frequencies come in. You basically do a treatment and you create this set of waves of actions that are moving through the tissues where the body does its thing with the energy that you've given it. And those waves can go on for weeks to months, or they can go on for microseconds. So you're amazed sometimes. You'll do one treatment, the patient's pain-free for about 4 or 5 days. Sometimes they're only pain-free for a few minutes. Sometimes they're not pain-free then at all. 3 days later, they call you back and say, my pain's gone. So it really will vary significantly depending on the pathology and so on. But basically, you're throwing a pebble in a pond, which is why we tend to prefer to keep repeating the treatments as opposed to, and the same thing applies to acupuncture, manipulation, massage, and so on. You do periodic treatments, and each one progressively maintains the benefits from the previous one, or ones. So you separate out the treatment effects. Complicated slide. I learned this slide a long time ago, 15 years ago, done by Germans, who basically were looking at pulse magnetic field effects in cells as opposed to static magnetic fields. As the magnetic field washes back and forth through the cell, in and out, you're pulsing it in and out of the cell, you're doing magnetoporation as opposed to electroporation, right? You're basically opening up all the channels in the cells. The sodium-potassium pump, the calcium pump, ATPase pumps, all these things are opening up, and what you're doing is you're bringing energy into the cell by opening, the analogy is that you've got a house that's all locked up. Windows are closed, doors are closed. It's stale air. You open up all the windows and doors, you get air in, and you get the waste out. That's what you're doing essentially with the cells. And so you create energy, increase ATP, upwards of 5-fold. Right? But you're also changing the charge of the membrane because now you have all this polarity changes going on. Cells that are sick build up charge on the outside of the cell. Once you open the channels, then all the charges equilibrate and the cell wakes up to the extent it can wake up. Okay? This is an incredible slide. If you see this in motion, it'd be even better. I don't have a slide that does it in motion. This is my book, and it's available out there. There's a show price for the advertisement. The show price for $30 is normally $40. I co-authored this with Dr. Jarabek, who's that Czech physician, the MD PhD from the Czech Republic. We redid the manuscript, reanalyzed some of the data, and
This is really very basic reading, and we have a bunch of them up here, and LaDonna is here, and she'll make sure that you get them. We have them up here if you want.
This is a technical book. I've sold this to a lot of lay people, but basically it's for clinicians. It's highly summarized, so you're not going to get you're not going to be able to read a novel. But it gives you a lot of information. I had one physician in Canada that had my book, and he says, I talk to doctors, and they want to know what the weight of the evidence is, and he drops the book on the floor. I said, that's the weight of the evidence. Because he knows they're not going to read that damn thing. Anyway, this gets complicated, but a lot of the action of magnetic fields are modulated through the calcium pump. That's been pretty well established. So a lot of these effects on the cell membrane cascade through the body. They create electrical currents, they increase SOD and catalase, GSH, heat shock protein expression, which modulates the immune system, coagulation, EDRF, PG, cell respiration, and then so as a result of all of these changes in the cell, then you end up with all of these basic actions. These are the basic biologic actions. Decreasing spasm of muscles, and those relaxing muscles. Analgesic effects. Studies have shown that magnetic fields have an analgesic potency of equivalent to 10 milligrams of morphine, even in snails. Snail equivalent to 10 milligrams of morphine.
What's it doing to interleukins or cytokines or substance P?
It's balancing all that. Essentially balances. And it's complicated what it does. Again, it depends on the field, depends on the charge, depends on the tissue, depends on the inflammations in the tissue, but generally speaking, it tends to decrease chronic inflammation. One of the things that it does for inflammation is it knocks off the chronic inflammatory cells. One of the problems with chronic inflammatory cells is they are not apoptotic. They're supposed to die. They don't die. Once the acute inflammatory process has been done with, the body's supposed to turn off the chronic inflammation cells. They don't. And so when you use magnetic fields, then what they found is that magnetic fields actually increase the apoptosis of the chronic inflammatory cells. So in that way, then it decreases inflammation. Improve perfusion, decreasing edema. Decrease edema, tissues are healthier, more circulation happens, right? Less discomfort and pain. And then anti-inflammatory. All this is at the local action of cells, and then obviously this cascades up to systemic actions. So you get this, all of this goes from treating the hand, basically helping the body. Like, the analogy of the knuckle. And these slides are actually in my book. So it's one so detail of these. And why I can't get into the immunology, you can read that chart yourself and try to make sense of it. But there's a lot of different ways that magnetic fields act in terms of the humoral responses and the cellular responses, immunologically. And that's actually an old slide. So this is a summary of those kinds of effects. I won't bore you with that again. But these are some of the things that you're going to see with magnetic fields then is vascular effects, coagulation changes, in other words, it tends to improve coagulation, increases fibrinolysis, and decreases platelet adhesion up to the equivalence of aspirin. Almost the same. Actually, with a slightly different mechanism, but it's about equivalent to aspirin. One of the Eastern European surgeons discovered this a long time ago. They never had to use antiplatelet agents or anti-clotting agents because their fracture patients never had DVTs if they were using magnetics after their surgeries. Right? And it's an important benefit of the magnetic field. Obviously, it speeds up recovery and healing of fractures. It has, obviously, psychological changes both in terms of the brain, but when you improve the health of the body, the psychology improves. Muscle, nerve, EEG, intestinal motility. Routinely, patients tell me their constipation goes away when you start using the magnetic therapy. Skin respiration, but you have to be careful because now they may develop an eczema when you start doing the magnetic field because that's another detox pathway, so you're beginning to detox the body. So you'll definitely get aggravation responses to magnetic therapy, and the Russians have discovered this a long time ago. Antioxidant activity. You can treat at the micro level, local, regional, or whole body, depending on the magnetic system you purchase. The Czechs and the Russians started all this stuff with checkerboard static magnets as early as 1978, even before that, I know. And in Hungary, they started using pulse magnetic fields around 1982, and the rest of Europe began to sort of follow after that. There's lots of controlled studies in humans on a whole host of conditions using both static and pulse magnetic fields. So if you understand the basic biology, I tell people don't focus on the disease. Understand the mechanism. If you understand vasodilatation, anti-edema, healing effects, RNA, DNA stimulation, analgesic effects, if you understand that, it doesn't matter what model you use. It doesn't matter what the disease is. You're going to be affecting tissue in a fundamental, basic way. Will you remove the disease? No, probably not. Can we remove the disease? Most of the time, once you got the disease, you got the disease. We can improve function, we can improve symptoms, we can improve the vitality, but you often can't remove the disease. Cancer, despite our best efforts, cancer is still incurable. Right? Because we don't get at the stem cell. So there have been, again, lots of studies in PEMF. A lot of those are outlined in the book. There were a lot more since then. And there have been lots of PEMF studies, specifically on PEMFs themselves as opposed to aggregates. There's a lot of confusion about magnetic fields. And when you read a paper on magnetic fields, you have to know whether it's a static magnetic field or a pulse field. Is it a frequency field or a time-varied field, or is it a static field? Big difference, right? We talk about that. Then you have to know what kind of pulse magnetic field it is. Low frequency, high frequency, megahertz, diathermy levels, microwave levels, very different. Microwave obviously heats and kills tissue. Most of the kinds of fields we're talking about are athermal or non-thermal. They don't heat tissue, so they don't kill cells. Okay, critical. In fact, that confused the physicists for decades. They were always looking for effects that would go beyond what they considered to be thermal effects in cells. And since they couldn't explain how magnetic fields work, they said they don't work because they don't get above thermal noise. But that's garbage. All right, so I won't go through all these, but there's a ton of those studies. MRI, inappropriate, they can be, unfortunately, inappropriate excitation of electrically excitable nerve muscle or myocardial tissue by the electric fields associated with the time-dependent gradients. So time-dependent gradients create charge. When you create charge, you create current. When you create current, you can overstimulate tissues. So you have to be mindful. You have to respect high-intensity fields. You have to know your business. I don't like to give a PEMF machine to a layperson until I've really educated them. I mean, you can stun a heart. If I can create charge in my teeth, what if they have metallics in their body? Okay, what if they're doing a treatment? The field from that PEMF system is huge. You have somebody who walks next to it who's got implant electronics. What? Be careful. Okay? It's good, but you have to be respectful and understand the system you're dealing with. Okay, I'm not going to go into MRI, but there's lots of stuff on MRI. But 4 Tesla MRIs have been studied extensively, and they know pregnant women work around MRI machines all the time. They often don't even know they're pregnant, and there have been no damaging effects in pregnancy of even high power, intensity, frequency, and static magnetic fields. Right? But we haven't done a formal study, so therefore it's still considered a contraindication. Just know, though, I have never seen a problem. In fact, most women who are using magnetics when they get pregnant and continue to use them when they're pregnant feel better throughout their pregnancy.
How about pacemaker?
Well, obviously, you do an MRI on somebody with a pacemaker?
I'm talking about
No. Static magnetic fields depends on the old magnetic fields. I had a doctor friend of mine who had a pacemaker, and I had a bag full of static magnets, and I was about 3 or 4 feet away from him. And he said, "Do you have magnets in your briefcase?" He had a relatively old, unshielded pacemaker, and it was starting to, do funny things. This is a typical figure of a coil, not the neurostar, but basically what's inside the head of the neurostar is this. It's a coil. And you can use these coils in different directions, just like you can use the coils on the PEMF 100. You can change the orientation of the coils. Michael Davis, the developer, says that if you have a chronic lesion, you should not just put it in one place. You should move it around that lesion so that you create perpendicularities in the tissues. And different tissues there's a concept called anisotropy. If you're isotropic, you're lined up in one direction, but the cells in the body are not isotropic. They're often multi-directional. And so in order to create enough change in the tissues, you have to move the applicator around to get the maximum effect for the total body of the tissue. Okay, and that certainly has been discovered with these fields for the head. Okay, I'm not going to go into this. These are studies that have been done on the Neo-Pulse machine, looking at detrusor hyperreflexia following spinal cord injury, and then magnetic stimulation of the S2, S4 sacral anterior roots. Lots of benefits. There was profound reduction in detrusor contractions. So presumably instead of using medications for people who have not stress incontinence, but what's the other kind? Hypertonic incontinence. They will get better with this as well. RTMS, motor cortical stimulation. One of the things they found is because they tend to treat brains more than anything else, you can treat chronic pain by treating the head. Where's the pain? It's everywhere. But where is it mostly interpreted? In the head. So if you treat the head with the RTMS coil, you can dramatically decrease significant pain reduction up to 8 days after real TMS as opposed to sham. Alright? And you don't have to use it at the level of contraction of the muscles around the head. You can use it at the 100 level, 100 millitesla level, down at the very low end. You won't feel anything. They don't feel anything. But what I will often do is I will take them up to the point where they can hear it clicking, or they get some degree of contraction, maybe somewhere else, and then put it over the head and bring it way down, and then just treat that. Okay, brain stimulation. This is rats, but there have been lots of studies done in humans, and you'll see more. As I said, you'll see more and more research related to other benefits of RTMS for things like Tourette's, chronic pain, MS, Parkinson's, spasticity disorders, neurogenic bladders, all these sorts of things. Anything that can stimulate along the nervous system, you're going to get a significant effect. But obviously, muscle, you can be able to rehab muscle significantly. But the MagStim produced less pain at the same isometric force. This is in stimulating quadriceps. So you can actually, basically what this is telling us is that magnetic quadriceps stimulation versus transcutaneous neuromuscular electrical stimulation, right? The magnetic stimulation is more effective in getting more muscles to be contracted, to produce more torque in the muscle. You get better effects with this. Now you've got a big athlete, huge body, well, you're going to need deeper stimulation than you can possibly achieve with electrical. High intensity PEMF and pain. Again, chronic pain, brain stimulation. Drug-resistant neurogenic pain relieved by motor cortex RTMS. Okay, so variable effects. Let me just move right through this. Well, you know, what I want to do is to, all I'm trying to leave you with is that you can have things like RTMS again, PEMF, depression, mania, movement disorders, schizophrenia, anxiety disorders, tinnitus, Parkinson's, Tourette's, deep chronic pain, autism spectrum disorders, piriformis syndrome, spinal pain syndromes, chemofracture, deep solid organ cancers. I have 2 patients I've treated with cancer now. One is a 75-year-old Vietnamese lady, an old person, who had stage 4 lung cancer. We've been keeping her stable for a year, using the nutritionals as well as the magnetics. She stopped treatments, and we did a repeated PET scan, and all the areas that she had, we had quiet for about 9 months, increased, lit up. So we got her back on everything again. I have another lady who's got a stage 4, I think it's a stage 4 low rectal cancer. She's not a candidate for surgery. And so basically, she's 70. Her husband passed away about a year or 2 years ago, and she's a converted Muslim, African-American lady, converted Muslim, and she says, hey, I'm ready for anything. So she doesn't want to do chemo and radiation. She knows how sick she's going to be, and we know that it's not going to help her that much anyway. So she's using the coil, and she says she could not sit before. She could not find a comfortable position seating because the cancer is so far down in the pelvis. So she's doing treatments basically 3 or 4 times a week. I give it to her for nothing. And she says, this is weird. I can sit. I'm very comfortable sitting on my butt. And she loves it. And she knows when she's not getting her treatment. She can tell the difference when she's not getting her treatment. But we don't do enough work with cancer, and I can tell you that we have to be careful. The PAPIMI people got into a huge amount of trouble because they were making claims. This is like the PAPIMI device. It's better. It's a better model, but it's like that. And so those of you, particularly in California, who worked on people who work with PAPIMI, be very careful. I don't tell people you can cure cancer, but I do tell people that this is a complementary therapy. If you understand what you're trying to accomplish, say that's fine, it's complementary. It'll help you with anything else you're doing. Research has actually shown that magnetic therapies can decrease the morbidity from chemo, radiation, and surgery, but it also doubles the kill rates. So you get a better effect. In other countries, of course, what we can do is we can convince the oncologists to lower the dose. But you can't convince American oncologists to do that. Not yet. Okay, I think I'm done. So, wow.
If you're doing other complementary treatments at the same time, for instance, IV, vitamin C, and you have them sitting on a coil, do you know if that's going to make any difference? Is it going to be more effective using the intravenous C than if you're not using the coil? Or?
Well, you know, unfortunately, we don't have the research. We really don't know. But we do know, based on magnetoporation and electroporation, that when you do, and you see this, I've seen it myself, where you actually have more side effects from medication when using magnetic fields, because the medication is more effective. More of it is being absorbed. So if you're doing whole body treatments on a regular basis, the gut, the cells in the gut open up, more porous, and so more of our nutrients will get into the cells better. So theoretically, again, lower doses, shorter treatment times. And that's certainly a possibility. You just have to watch out for toxic things that you're more likely to cause side effects. If they're on a lot of toxic drugs, antiarrhythmics, anti-seizures.
And do you use this in your practice?
Yeah.
Do you have several?
I have 2.
Everybody, we're very lucky to have Dr.